Facebook is a household name now. Gather social media is going to be a household name. But this has swag. Household name with swag.
I love that.
Yeah. A lot of people don't actually do Facebook. They don't go there because they don't even know how to. They don't see it. They don't fancy it. It's for young ones, who go there to make money. Then if they are monetized any year, they are lucky to be monetized. Gives you instant monetization. The area I'm talking about is the area of monetization. Other platforms will tell you 5,000 followers to be monetized. But I'm telling you that you don't have to go through that stress. Just come in, post. People view your post. Please check your wallet for me. Already you have made money. And this money you withdraw to your local bank account. And the good news is that this platform has been so modernized that now to post is so swift and simple, continue and all that. So when
just upload.
Yeah. So we had to shut down the enjoying. If you cannot post, if you cannot log in, please let me know. Let me tell you the procedure. This place is a platform where you make money. People withdraw 10,000, 50,000, 100,000, on a weekly basis. Okay. People do that. Last week we had 1,030 withdrawals. A lot. Okay, is this platform just for people to post, make money? Is there another thing in this platform that can help the so-called wealthy? Yes, the rich ones. There is this adage that says the rich are getting richer, right? Mm-hmm. Because an average rich man is looking for a way to multiply that 1,000 he has in the bank to 2,000. So I'm telling you that this platform is also for you. It's not for just students, for your children, no. It's also for you. Now, in this platform, we have digital assets that appreciates like pure water. Because people come into this platform to do one thing or the other, they notice the digital assets, they buy it. Okay, for example, people that bought this asset last year, late last year, they have made over 20 folds of what they started with. 200,000 in the evening. So anybody that tells you that, don't listen. Please don't waste that 100K. Use it, even if you don't know what to use it for, please. Use it and eat chicken. Or KFC. Chicken. Use it and eat it and put it
or Romeo's Pizza.
Or Romeo's Pizza, But I'm telling you here that this is a place where we build wealth for people. We build it. Tomorrow you will be happy. I keep saying it. We are not money doublers. But we build, we grow people's wealth, we water it. But we build, we grow people's wealth, we water it until it grows. And when it grows, my sister, my brother that are listening to me, it will be uncountable. You go the chop am, you go the replace. So we have our share in Gather social media platform. This share started in 2 cents. 6 months ago, 2 cents, just 2 cents. Today, this share is $11.25.
Okay.
Do you know how much this shares is going to be in the next 6 months? In the next 1 year? In the next 2 years? 3 years? 4 years? We are building people's wealth so that's your child that is still in primary school will be able to attend university education abroad. That is what we do. Because we are doing the right thing. It's only the wise ones that locate us. But those that are dubious, they don't. Because they want it sharp and their money keep going sharp. But if you build with us, trust me, you are not going to regret it. I keep citing an example with a woman that bought our asset last year, Jude. You see this woman? This woman bought our asset with just 100K.
Okay.
Do you know that as I speak with you, this woman has up to 130 pieces of this asset, 130,000 pieces of this asset? Do you know that today, As in this, connect who you can connect. Invite who you can. Even invite your enemies. It's going to be mega. We are going to teach people how to use this thing called their phone to be making money on a daily basis. Remember, Gather gives you money on a daily basis. Gather social media platform. The assets and shares give you money on the long run. You get it now? On the long run, you make money in our shares and assets. But Gather platform gives you money on a daily basis, and you withdraw to your local bank account.
Okay.
So come for the training at Sweet Sensation 3 Obebi Road by 10 a.m. on Saturday. 10 a.m. on Saturday. Sweet Sensation 3 Obebi Road. The only Sweet Sensation in Obebi Road. Where there is a construction going on the road, don't mind. Just enter. Tell them that you are for training. They will let you in. Please, that is a paid venue. Don't come by 12 and demand training.
The cocoa for me is your number. That woman, they wait.
Okay. So now the number. So book me so that I can send you the address. Book me, please, so that I can reserve seat for you. You know, it's a mega training. 080 375 057 WhatsApp preferable. 080 375 057 37. Now my PS number, I don't fail to drop this number.
Exactly.
My PS number is 081 60 65 39 56. My PS number is 081 60 65 39 56 956. Now my personal number is 080 375. Say 1 month elapses. Say 1 month elapses. So this company has a lot for Nigerians.
That's great.
Yeah.
Super great.
Very great.
Before you go, this is Voice of the People 90.3 FM, everyone. Up next is a conversation with Dr. Charles. Conversation right now on this dial. Voice of the People 90.3 FM. But don't forget, my name is Jude. Ikami Jude. Stay there. I'll be right back.
Ndewo, my country people. I say make I remind you now. The radio station where they allow you talk your mind, they for this Lagos. Now Voice of the People 90.3 FM, where you fit listen to better programs and shows.
Hey, Oga wa Town Crier, ṣé wọ́n ní jolly entertainment program ṣá?
Of course.
Do they have political programs and news for intellectual savvy people like me?
Oga Professor, that one sef dey.
Excuse me, sir. Do they have children programs too?
My dear, children sef get their own segment. Any other questions?
Wait, now what be the radio station number? The frequency na 90.3 FM, Voice of the People. The number one ogbonge station where they give you a voice. Rush, make you go listen now.
Voice of the People.
VOP 90.3 FM. Voice of the People Radio.
Hello, is that Voice of the People Radio?
VOP 90.3 FM.
You are listening to your the number one station. Voice of the People 90.3 FM. Do not touch that
the
dial.
issue of palliatives. I will enjoy Nigerians to collect whatever palliative they bring to your side. That is the truth, especially in terms of money. Because if you don't collect it, this money will be embezzled by people who are top government officials. So the time you are saying you are not doing you are just being yourself. Collect the money before they embezzle everything, put it into their pocket or take it to Igbo country. Collect the money and use it for your own good.
This is your number one radio station at VOP 90.3 FM.
These issues back to back and help you understand, what you should do if you have someone who is suffering that around you, around your area. All right, you just know what to do. All right, first of all, let's understand breast cancer, because I think the last 2 weeks ago you touched on prostate so much. All right, so let's talk about breast cancer.
They are able to know that they have a lump, but for some people it is picked up only when they go for scans, and it's advised that women who have
what you call it again?
Mammogram.
Okay.
So it's men who have
what you call it again?
Mammogram.
Okay.
So it is advised that women over the age of 40 should go for this investigation so that they are able to pick up any masses or any lumps on time. But for women who are less than 40, they can go for a breast ultrasound scan, which can also help to locate these lumps. And sometimes the lumps are cancerous. That means it was sent for a test, and that analysis has now confirmed that it is not cancerous. And then you have to be sure that everywhere you are going to see your medical professionals, every laboratory that you are using for your pathological studies must be reputable. It's very, very important. You can't just put your health to chance, because your life may depend on it. So there's a strong genetic link at risk of developing that. Women who use oral condom, the illnesses that they are predisposed to. So it's very important that once you find a breast lump, using all sorts of mixtures in the hope that it is going to melt, and then at the end of the day, when they find out that it now becomes fungating and becomes very complicated, and then the skin is now ulcerating and is emitting a bad smell or is really looking horrible, then they now remember to come to the hospital expecting a miracle to happen. So please, we need to do better. We're creating awareness on breast cancer. Breast cancer is something that's, please, when you see a lump in your breast at any age, please see a doctor. Let the relevant test be done. Let it be removed and sent for histology. That's what we call a biopsy. They take a small sample of that lump, send it for a test. They analyze the tissue, they analyze what makes it up, and then they can tell for sure is it cancerous or not. If they say it's benign, it's not cancerous, we thank the Lord it is not cancer. John, who would possibly do a surgery for you. So in some cases, they may advise that you do what we call a mastectomy, which is removal of the breast, and that is very crucial. And then not only do they remove the breast, they also remove the lymph nodes in the armpits, in the axilla, because those are known places that can transmit those cancer cells to other parts of your body and facilitate the spread. By the time cancer is spreading from the original site, it is becoming very serious. All right, so nobody wants to wait for that stage to happen. So the first thing,
cancer without having to even cut any part of the body,
that is why we say time is of the essence. If it's picked up early, it can affect the milk ducts on the breast. You have the ones that affect the gland from the biopsy, like a growth. That's what a tumor is. So it could be cancerous or non-cancerous. So you can have a cancerous tumor and you can have a non-cancerous tumor. So a tumor is just basically a growth, a lump, something you can feel, something present that was not there before, something growing that can grow, increase in size with time. That's a tumor. But not every tumor is cancerous. but you also have cancerous tumors. So that's why we need to do a biopsy to differentiate them.
And someone is asking, they say, please, doctor, what causes prostate in a man's body? Because according to him, he said he has it. And please, what kind of drugs can he take? That's what he's asking.
Well, when you say prostate is just a general term. It's just the prostate. You're referring to the prostate gland that is in men. So basically, you can have the normal enlargement that comes with increasing age, or you can have prostatitis, which is infection or inflammation of the prostate, and you can have prostate cancer. So there are 3 different conditions that are related to the prostate. I am not sure which one he's referring to, but if it is the one that comes with increasing age, that okay, the prostate is a bit enlarged and is obstructing urinary flow, you may be experiencing frequent urination at night. Several times in the night you feel that you need to pee, and then you may feel that you cannot hold the urine. Once the urge comes, you need to rush to the bathroom, otherwise you may pee on yourself. And then you also find out that the frequency of urination is so much, you keep going on, and even when you go to pee, you also notice that the stream of the urine is poor. It's not coming at the right pressure. It's coming trickling out. And then apart from that, you still feel that you have some residual urine left in your bladder, that you're not completely voiding your bladder. All those are symptoms of enlarged prostate. But the best way for you to know is go for your PSA. The prostate specific antigen test is a blood test. Go and do that test. It's advised that every man over the age of 40 should do it at least once a year. So you go and do that.
Say that again, please.
The prostate specific antigen is a blood test that every man over the age of 40 has been advised to do at least once a year. Yes. So you need to go and be checking all this.
Whether with capacity or without capacity.
You must find that capacity somehow.
So like you said, once a year.
Once a year, you need to get.
Not like you do it this year and you don't have it, and that's all.
And one thing is, because you are getting older each year, so you need to keep checking. For some people, they've done it for 5 years. Maybe they started doing it at 40. At 45, they said, I've been checking it every year. In all day. So why am I bothering myself? Maybe now 47, the thing will come start.
When I press my breasts, my balls, I notice something like a...
We've mentioned this, that not all lumps are cancerous, but nobody is not written on anybody's head. You need to go and get it tested. You need to go for the appropriate investigations. If you need to go for an ultrasound scan, you go for an ultrasound scan. If you need to remove the lump and do a biopsy, you need to do that to confirm what kind of lump it is. And it's important I mention here that breast cancer, let us not mistake it that it happens only in women. It can affect men as well.
Breast too.
Absolutely correct. Okay. So a man too can have breast cancer, though it is not as common as you find it in women, but it is a possibility. It's something too that can happen. So this last person that asked this question, we're not sure if it's a male or a female.
It's a female.
But just to say that men also can have breast cancer. It has been seen and documented.
Okay. I noticed something like a stone in both of them.
If there's something about your body cells. Your body cells have gone haywire in terms of cell division in cancer. It is not originating from your own system. So you cannot inherit it from somebody else. You cannot get it. It's not a contagious, transmissible disease. So it is one of the diseases we call non-communicable diseases.
It means this guy is free. He's free from this thing.
But he may not be free from some other things. He may be free from breast cancer, but maybe not from some other things.
They make this guy fear.
No, it's good for us to be honest now and tell the truth now. Because we are talking of cancer here. Before you think you are free from every other thing, you may not be free from some things. Just like some people will say when they do, use condom and then they practice safe sex. Are they protected from? Yes, it may protect you from pregnancy, but sometimes some things may happen and you may still end up catching some diseases that you didn't bargain for. All right, so we need to be careful all the same. Blocked or both are blocked, and then you'll find out that you can't achieve conception. And most cases, you have blocked tubes from improperly treated pelvic infections, STIs, or other infections that you've had over time that you didn't manage properly. You can have blocked tubes from those, and those can cause infertility. Then also, you want to rule out other hormonal causes. You have high prolactin levels, which can affect your menstrual cycle. and then you want to find out, do you have thyroid problems? You do a thyroid function.
Okay.
In case your menstrual cycle is irregular, you want to find out if you are hyperthyroid or hypothyroid. All those are important factors. You also want to find out if you have what we call PCOS, polycystic ovarian syndrome.
Okay.
Which typically presents with poor quality eggs, and then you find out that the woman is having irregular periods. You find out that the woman may be growing hair more than usual. She may have acne outbreaks, a lot of pimples on her face and body. She may also be obese, overweight. And then even if she gets pregnant, she's always having recurrent miscarriages because the eggs are not good quality eggs. All these are very...
This person had CS, sometime
previous CS. Some women have all their children via CS. So it depends on, where you had your CS done, or if there were other complications that you didn't know about. But for me, I don't think your CS has a crucial role to play in your conception. For me, I would rather have you, I would advise that if your menses is regular and you are ovulating and everything about you is fine, so to say, then your husband should get checked. You should go for a seminal fluid analysis, because sometimes we find out that men, after they've had like 2 children or so, they're always believing that because they've had children, they are fine. But you can have a decline in your sperm quality over time. I've seen people that maybe after 2 children, they are not trying to have a 3rd child. It now takes a whole while to get pregnant again. But when the man goes for his test, he finds out that the sperm count is not ideal, the motility is not ideal, or maybe there's an infection in the picture. So,
okay, this person is asking for men who ejaculate this whitish jelly-like thing. He's asking if it's normal for a man. People who ejaculate, is that is a whitish jelly-like ejaculating normal for a man?
But you're not...
I mean, from Unilag, he's asking this question.
Yeah, those things that we use to keep the foods fresh, either they are fruits or drinks or whatever it is, those preservatives to make it look fresh and appealing to the view.
Okay. Thank you so much, Doc. Appreciate you. Thank you. Yeah. My name is Jude. Ikami Jude. And for me, on all social media platforms, all of them, Facebook, Instagram, Twitter, YouTube, TikTok, all of them, I am IKAMIJUDEH. IKAMIJUDEH. That is Ikami Jude. I'll be here tomorrow morning. We'll continue the conversation.